and saved hundreds of thousands of babies from the abortionist scalpels. We have to do the same. Do you think that the states in America who have insisted on pain-capable legislation went away after Roe and Wade in 1973? They didn't. They continued to inform, to educate, to persuade, and to change law state by state by state. These ugly realities cannot be ignored and must not be ignored. And there are so many of you in the audience who are doing so much good stuff. I was talking to Joanne earlier, a social worker who, with a number of her colleagues, all of whom are pro-choice, has put together a letter which is asking TDs to consider some of these points because they're very unhappy and uncomfortable with them. I was talking to Maeve in the front row, who's put together a very nice cheat sheet with lovely kind of cartoons as well on the legislation to try and explain it in an easy way. You know, the suggestion that babies will be delivered if they're viable, that's of course if they haven't got a fatal fetal abnormality or a new way of dealing with medical emergencies. Viability, apparently, is when a doctor considers a baby couldn't have survived outside the womb without a major intervention. When I hate to tell you guys, but the major intervention would include my first baby. You know? And she's alive. And most babies born at that stage and much earlier can survive with the major medical intervention. What is the purpose of medicine if it's not to help and assist and protect life and strive for life? I'm sure there are many other things that I should say about this legislation. Just to let you know, we have all at Pro-Life Campaign been working very, very hard on it for the last few years. We've been working very hard on suggestions around conscientious objections, suggestions around fetal pain relief, suggestions around notification. This is really important. The government has got away with murder, perhaps literally. In the 2013 legislation, there is an obligation on doctors to notify to the Minister for Health terminations under that legislation, and an obligation on the Minister then once a year to issue a report on the number of terminations of pregnancy that took place in the previous year. The thing about that legislation is that those terminations of pregnancy would include cases exactly the same as my first child. So when we hear that 23 or 25 babies were that pregnancies were terminated under the 2013 legislation, we don't know how many of them are alive and how many of them were given neonatal intensive care. They're all included. My first child under the 2013 legislation was aborted. Can you believe it? And under the notification procedure in the intended legislation Simon Harris is touting today, there is a minimal notification process. The detail required in the UK is extraordinary. You know the mother's age, her ethnicity, the area in which she lives, why the abortion was carried out, how the abortion was carried out, what was the outcome of the abortion, what drugs were used. We want at least the same level of detail. It's necessary, whether you're pro-life or pro-choice, to inform healthcare policy and to inform academic research and study. This is necessary. The government will probably say this will be done by statutory regulations. We can't rely upon them to do this. The only way we can rely upon them is to insist that there is some provision made in the primary legislation to deal with proper notification. So that's something else we have to be talking about. So, ladies and gentlemen, you are magnificent. You have worked so hard. We all have worked so hard. And we have worked hard for a long time. And we have kept abortion legislation from this country for a very long time. And now we are dealing with something that is very radical. That is, it is hugely ambitious from the pro-choice perspective. And as we've been reminded, she's reiterated what she said in 2013. Claire Daly has said, this is the end of the beginning. So they are going to go further. Let's not forget that. You were nearly 1 million votes this summer. Make it count in the general election. Please, please, please educate yourselves. Call the radio stations. Write in the newspapers this week. The government is going to be debating the legislation next week. Make them hear you. Don't let them ignore you. And one of the things we have been addressing for a long time in Pro-Life Campaign is the imbalance in media reporting. The imbalance in trying to get our voices out. And that is something that you'll be hearing more about from us as soon as this legislation has been dealt with. It's critical that the organs of publication and the dissemination of information are not able to ignore us, and so we may have to make our own. But thank you for all the work that you've done. And the last thing I promised to do, and I haven't invited to it and I'm going myself, is decision making in everyday practice, the conference for lawyers and healthcare professionals that is on October the 13th in the Crown Plaza Hotel at 9:30 in the morning until 3:30. It will be well worth going to. Very, very good speakers, including Dr. Mary Neal, who's written quite a lot on conscientious objection. We have to get the legislation right. And we won't unless you make this so uncomfortable for the government in the next week, because